Good morning, everyone. I'm Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well. And today I'd like to welcome Tarina Sherry from the Alzheimer's Association of the Greater New Jersey chapter, who's going to share some information with us today on Brain Health Awareness Month.
Thank you, Kathy. Hello, everyone. My name is Tarina Cherry. I'm the program coordinator with the Alzheimer's Association Greater New Jersey chapter, and I'm so happy to be here with you today, starting the month of June out as it is Brain and Alzheimer's Awareness Month. So today I'm going to share with you a short presentation just to discuss the prevalence of Alzheimer's and the ways in which we can get involved within the Alzheimer's Association. So our vision is a world without Alzheimer's and all other dementia. And we work towards this vision as we continue to go into community and provide information and resources to individuals, families, caregivers, and also healthcare professionals. So in terms of the risk for individuals that are likely to develop Alzheimer's and dementia, these are the risk factors that we have here. The first is age. Of course, individuals that are 65 and over are at a higher risk for developing the disease. And then we think of family history. If individuals have a loved one that is a sibling, a parent, someone that is close to them that has the disease, they are more likely to develop this disease as well. Heredity is another risk, as well as head injury and lifestyle choices. So as you can see, 1 in 3 seniors dies with Alzheimer's or other dementia, and it kills more individuals than brain cancer and prostate cancer combined. So this is why we feel that this is a disease that we should share as much information as we can within our communities. So we really push the importance of an early diagnosis, as it can have emotional, social, and medical benefits. So it's really important to truly understand the symptoms of the disease in which the diagnosis comes, to explore those treatment options which may be available, especially in those early stages, to improve our health outcomes, which we do have an education program, Healthy Living for Your Brain and Body, that speaks on several different aspects of health and ways that we can increase our ability to live healthy lives and decrease our chances of developing the disease. Early diagnosis also prevents complications. It allows the individuals and their families to make legal and financial decisions in advance, and also offers accessible care services. And early diagnosis allows individuals to participate in clinical trials at the earliest stage possible. So in regards to our 2024 facts and figures, it's important to know that nearly 7 million Americans are living with Alzheimer's, and that, as shared on the previous slide, 1 in 3 seniors die. So this is why we want to share this information in as many senior centers, civic centers, assisted living facilities as we can, to ensure that the older adult population is aware of the risk and also aware of the access to resources should this diagnosis come about. There are over 11 million American unpaid caregivers. So this is a number that is extremely high, and we want to acknowledge that because these are individuals that are most likely a family member that are caring for their loved ones at home, and they may also be caring for several of their family members as well. In 2024, Alzheimer's and other dementia is going to increase to a cost of $360 billion. And by 2050, those costs are going to rise nearly to $1 trillion. These are very important numbers, as finances is an important area to focus on when it comes to Alzheimer's and dementia. And in terms of New Jersey, the prevalence is over 185,000. So those individuals that are 65 and over are living with Alzheimer's in New Jersey. And the number of caregivers and that number of unpaid care that they provide is continuing to rise. So in terms of being involved with our association, as an individual, if you have a personal story or a relationship that you would like to share, that is a way in which you can get involved as a volunteer. You can help out in your community and provide education, as well as be a support group facilitator for the groups that individuals' families attend. You can also get involved in clinical trials or research studies. Start a fundraising team, as we have our Walk to End Alzheimer's, and we also have the Longest Day initiative that takes place in June. There is a way to get involved as an organization. You can start a walk team. In regards to what we do in the Greater New Jersey chapter, throughout different states, there are other initiatives such as the Ride to End Alz as well. You can also host an educational program at your facility that you're employed within. And that just provides the individuals within your facility with the opportunity to learn more about the disease, the ways in which they can eliminate the risk, and also work towards bringing about more awareness. You can also share resources with your associates, neighbors, and your friends as well. We provide brochures that we can share out by mail, or we always welcome individuals that are partners to come to our Florham Park office to receive this information as well. And for you and your family to get involved, we have our 24/7 helpline. These are master's level trained clinicians that speak in over 200 languages. Our number is here on the screen, 800-272-3900. You can also visit alz.org. There's a plethora of information there about research that is ongoing, about medications, access to clinical trials. We have information about our education programs, as well as our support group and caregiver resources. And we also have our community resource finder that can allow you to locate long-term care facilities. You can locate transportation, any resource that may be available to a person or a family member of an individual that they're caring for that is living with Alzheimer's or another form of dementia. So that was our general awareness presentation. I do want to open the floor for any questions or any comments that anyone may have at this time.
Before you do, Tarina,
Yes.
I just wanted, Kathy, deferring to you, of course, I would like to dig a little bit deeper into some of the statistics. Tarina, wonderful job in terms of providing a really great overview about what's going on. There are some statistics on specific populations that, as we work in communities that are, prioritizing aging well, I think it's important for us to be mindful of what the situation looks like for different subpopulation groups that are within our communities, that oftentimes when we take this generalized approach to, service provision, we tend to miss how we can adequately support them and support everyone holistically in terms of aging well. So, Kathy, if you don't mind, probably another 5 minutes.
Oh,
and
sure.
I'll share a few slides with that information.
Yeah, let me give you the ability to share screen. Go ahead, you should be able to share now.
All right, perfect. All right, so I wanted us to just look, there's some information that is repetitive. I will skip that information, recognizing that Tarina covered those in detail. But one of the things that, as we talk about Alzheimer's within our communities, it's important to look at prevalence rates. And so before I talk a little bit about prevalence rates, I just wanted to stop a bit because, to take a look at what is dementia. And it's important for us to kind of take a deep dive in terms of what is dementia, because oftentimes in some communities, there is a stigma towards some forms of dementia like Alzheimer's. We've found that in some African-American communities, as an example, persons prefer to use the term dementia and not Alzheimer's because there is a negative connotation that's associated with Alzheimer's. And it's okay to use that terminology, but it's important for us to understand that dementia is the umbrella term. Alzheimer's is one type of dementia. And so through diagnosis, individuals would be able to determine which type of dementia they have, whether it be Alzheimer's or another. And that said, Alzheimer's is the most popular type of dementia. Now, when we're talking about prevalence rates, we're really talking about the numbers of people within a specific geographic or geospatial and demographic groups that are living with the disease. And so when we talk about geospatial groups, we're talking about whether the US population as a whole, and we'll see that number later on, and that was covered in Tarina's presentation as well. We also, in terms of geospatial groups, are thinking about the state of New Jersey or a specific town or city or county within specific areas. And so understanding the geospatial prevalence is important because it means that we now need to take a look at what types of interventions, what types of services exist or do not exist to support people within those geospatial areas. And when we think about demographic groups, we're thinking about persons who are of specific ethnicities or races, or individuals who are defined by their gender and the differences based on gender or sexual identity and so forth. And so in terms of the 2024 Facts and Figures report that Tarina alluded to, it really premises this notion of prevalence on the not on a clinical diagnosis, but the existence or the prevalence of clinical symptoms among individuals who are within a particular geospatial group that is representative of the US population. And so the numbers that we're sharing are estimates, but as you understand statistics, they use a longitudinal study, of course, but if you understand statistics, they basically ensure that there is representation based on race, ethnicity, etc., and that the space that they're choosing really reflects the US population. But certainly that might not necessarily be the case. And so one of the things, personally that when I'm talking with communities, I'm advocating for is how can we advocate for greater funding, whether at local, state, or federal levels, for us to take a deeper dive in terms of what is the prevalence within our specific communities at a county level, et cetera, so that we can design targeted interventions to address the problems within our communities. But certainly one of the advantages using that approach, which is, looking at one specific representative geospatial area, is that they were able to identify individuals who are not necessarily clinically diagnosed, because when they did a study of clinically diagnosed persons, it was highly underrepresented of the numbers of people who are actually living with Alzheimer's or another form of dementia. And so taking this approach allowed them to be able to, just as you did with your study, Kathy, recently, it allowed persons to self-report based on a series of questions that demonstrated that they fit within the scale of mild to extreme cognitive decline. And As mentioned before, dementia is the umbrella. Alzheimer's is one form. There are other types. We have vascular, Lewy body, frontal temporal, and others such as Huntington's, as triggers of dementia. We spoke about the mild to cognitive. This really reflects the continuum of the disease. It's a disease that moves from no symptoms at all to a very severe stage where persons have a difficulty in swallowing food, as an example. And so it is important as community leaders for us to understand how this disease progressively impacts the individual, but also those who are caring for the individual, as well as the contribution of those individuals to the community in terms of the ability to, contribute in terms of work, taxation, and so forth. It has a ripple effect down the road. Oftentimes, when you think about Alzheimer's dementia, we think about it on its individual impact within a family rather than at the community level. And I think it's important for us to start to think about the community-wide effect. A caregiver who can no longer work has a lower contribution to societal development and community development. And it's important for us to start thinking about what loss to the community we're experiencing because those persons have to step from the workforce in order to provide unpaid care to individuals who are living with Alzheimer's. We spoke about the demographic populations being, in terms of the prevalence. And research has found that people of Afro descent are twice as likely to live with Alzheimer's compared to white Americans. Persons of Hispanic descent are 1.5 times as likely as white Americans, and women are twice as likely, 2/3 as likely compared to men to live with Alzheimer's. And so as we think, roughly 50% of our population, a little bit more than 50% of our population are women, and we are disproportionately affected by this disease. What resources as communities that are prioritizing aging well are we putting in place to ensure that our women are well cared for in later life if they are so affected by Alzheimer's dementia? What resources do we have in place for caregivers? We see caregivers are also disproportionately women who oftentimes, by the time the individual gets to the middle stage, has to step from work in order to provide full-time unpaid care. Now, as we look at the demographic communities, I couldn't help but to drop this slide in. And here are seven counties across the U.S. They are in New York, Maryland, Georgia, etc., South Carolina, and so forth, Louisiana. And these are 7 communities with the highest prevalence rates. The prevalence rates is that first percentage that's denoted next to the state acronym. So in Bronx County, New York, for example, 16.6% is the prevalence rate. It means that more than 16 out of every 100 citizens is living with Alzheimer's in Bronx County. And when we look next to that figure reflects the percentage of that county that is Afro-descendant. So if we take as an example, Hinds County in, I believe this is, which state is MS? I always don't know this one. But if we think about the prevalence rate in Hinds County as an example, 15.5, so 15 out of every 100 persons living in Hinds County lives with Alzheimer's dementia. And that county is predominantly an Afro-descendant community of 73%. And so it's important for us as we do work in our communities to understand what is the racial breakdown of my community, what is the prevalence of Alzheimer's within my community, who is disproportionately affected, who are the caregivers within my community, what resources do we have available? Is there someone in my community who's trained to educate others? Is there a support group that persons can access so they don't have to travel beyond a 15-minute drive to get there? Are there care facilities, assisted livings, adult daycares within my county, within my community that persons who are living with this disease can access so that the caregiver can get some me time in order to recuperate, because it's a really difficult disease to care for. And then moving on, sexual and gender minorities, it's important for us not to forget this group, you know, because oftentimes when we think, we really don't include them in the mix, and they are at risk because of systemic discrimination, marginalization, and exclusion from social organizations. To what extent are our community-based organizations inclusive of all the diversities that exist out there beyond race and ethnicity? Is it inclusive of persons who are from sexual and gender minority groups? Is there research being done about the prevalence within these communities in terms of community health or learning initiatives, social engagement? To what extent are persons from the SGM community invited, supported, embraced for them to be able to live and age well in our communities? I'm not going to go over this slide, but this slide really covers the prevalence within the SGM community. Findings are not yet at the national level, but studies are increasing looking at the impact within this community. From just a quick sweep of it, some findings are inconsistent, others point to a clear heightened prevalence among persons who are within the SGM community. And I can share this with you as well for you know, your own reading. But as an example, when they looked at, for example, Medicare beneficiaries who are estimated to be living with, who are believed to be living with dementia, the prevalence was seen as 18% among transgender adults who are 65 years and older compared to cisgender adults. And so that shows that there is a clear, you know, disproportionate effect of Alzheimer's dementia among transgender versus cisgender individuals. And then in terms of going to our state, and I'll use this slide, Tarina used this, this image here, which kind of summarizes that prevalence. In the US, 6.9 million persons are estimated to be living with Alzheimer's. We have 9.2 million persons living in the state of New Jersey. We are the 7th highest disease prevalence in terms of Alzheimer's in the country. That translates to 185,300 persons. However, what is most alarming is the growth rate. It's expected that by 2025, this is 1 year away, this number will increase to 250,000. That's, in my mind, an exponential growth in a short period of time. And with that, I will stop sharing, and you know, essentially we can kind of breathe and think about the impact of those statistics on the work that we have to do. What can we craft in terms of support initiatives within our communities to ensure that persons living with Alzheimer's and other dementias are taken fully on board with or priorities around aging well?
Thank you. Thank you both. I just want to put out, going back to the Alzheimer's support line that Trina mentioned earlier. It's that I, as I've told you both, my mother has Alzheimer's, and I've used that support line several times, and I really encourage people to use it. It's I think it's manned by volunteers, but then if needed, a professional caregiver will get back in touch and help you. And the Alzheimer's is not a linear disease. It circles back, and it's different for everyone. It's not clear cut, which is one of the hardest things to do as a caregiver, to know what's coming next and to know what to expect, because it's, I think if you've seen one Alzheimer's patient, you've seen one Alzheimer's patient. So I highly encourage people to use that number. It's a great support. Do we have any questions from our listeners? I want to thank you both for your very thorough presentation, and we will post this recording on our website so that it can be shared for future use. Thank you for all of the work that you do and for being with us here today.
Thank you so much, Kathy. Have a wonderful day.